When we talk about legal issues in nursing, a lot of what I'm going to present to you is review. These have been presented to you throughout the program starting back in 102. Some of the federal laws you need to be familiar with. One is your HIPAA, and remember your HIPAA, that is your confidentiality of patient personal health information. You also have a Patient Safety and Quality Improvement Act, and basically what this does, it allows providers to release non-identifiable patient data to analyze medical errors. We also have a False Claims Act. What this is it's saying that yes, it is illegal to submit false claims to the government for payment. And two things here. One, the person who reports it has whistleblower protection, but also that person that reports it, they can actually get 25% of any money that's recovered by the federal government. Now, ADA, I think we're all pretty familiar with ADA. When we talk about ADA in healthcare, primarily what we're talking about is the need for an interpreter or interpretation services for our patients that are unable to effectively communicate. We also have our Patient Self-Determination Act. Again, remember that allows patients to either accept or refuse medical treatment. But this also covers their ability to participate in treatment decisions and to actually make advanced directives. Some statutes that you're going to need to know. We talk about child abuse prevention and active treatment. Basically, remember that you have to report any suspected child abuse. So the thing is when I say report it, you have to follow your hospital policy. Your hospital will have a policy for reporting. Most of them, what you do is you report it to social services, and social services takes care of it from that point on. Okay, so that's what you need to realize you're going to do. You're not going to call up anybody and say, hey, I got a suspected child abuse. You need to come in here and check it up. You follow your protocol, because when you don't follow your protocol, you get in trouble. So for most hospitals, that's social services. They've been trained to deal in those situations. We have another statute that you may be familiar with. This is your family violence statute. Now remember, this basically deals with partner abuse, any type of domestic abuse. Remember, in some states that's not reportable. Here in Alabama, you do not have to report suspected partner abuse. However, other states do. So I provided this link for my people that are going to practice outside of Alabama. They can go and look and see what their state says. Now, another thing we got to report are, of course, certain diseases. You'd be surprised by the number of diseases we actually report. So I provided this link so you can go and you can look at what diseases we report. Remember, we track these. We track these state and we track these nationally. So that's why it's all reported. But again, there is a policy in your hospital to how to report things, and you need to follow your hospital policy. Some state laws you need to be familiar with. One is your Nurse Practice Act. I provided this link. This takes you to the Alabama Board of Nursing. Once you go there, you're going to go to the right-hand side. You'll see a tab that says Laws. Hover over it, and you will have your Nurse Practice Act come up. Please be familiar with your Nurse Practice Act. That defines the scope of your professional practice. You need to know that. You are liable if you do not know that. Okay? Some other things I always have new grads ask, well, what happens if someone files a complaint against me? Well, in your book on page 129, box 8-1, it gives you great examples of what happens. It walks you through the whole process. And what you need to realize is that anybody can file a complaint on you. And then another question I get asked a lot is, what are some grounds for disciplinary action? Again, it is laid out for you in box 8-2 on page 129. Now, some things that are not in your Nurse Practice Act, one is overtime, and the other is stated nurse-patient ratios. I know those are really hot topics in healthcare these days, but your Nurse Practice Act does not cover that. Now, when we're looking at legal issues, we have certain type of laws. So we're going to talk about those. Common law, these are laws that were made by a judge, and these were cases that were heard in federal and state courts. These laws were made on the principle of do no harm, because remember, in healthcare, that is our guiding principle. Now, we also have case law. Case law has been laws that are established based on current standards of practice. So these are laws that are backed by evidence and then professional opinions of nurses and doctors in the field. Okay? So this is why I always say, when you are ever in doubt, you always stop and ask someone or look it up. Okay? Now, we have case law in action. These are more your malpractice, and I know y'all are very familiar with malpractice. So some of the examples I've provided for you here are for nurses, okay? Because remember, we can sue people for malpractice also. This example I gave you right here, it was a violation of civil rights, wrongful termination, or any disciplinary action taken against nurses. Now, a great example of this is a few years ago in Texas, these 2 nurses refused to get their flu vaccine. And because they refused their flu vaccine, they were terminated from their place of employment. So they filed a malpractice suit against that hospital, and they won. So that is an example of malpractice. So I put all these laws here basically to tell you, you need to stay current on the legal issues regarding your practice, okay? Some ways you can stay current. One is you need to join an association. Now, a lot of times when you get to nursing school, you're not going to know exactly what type of nurse you're going to be. It's going to take you a little while to find your niche. But once you find that, you need to join the association. Get journals, okay? Make sure you're current with your news according to your specialty. That's how you stay current, and that's how you stay up to date. Now, some civil laws. Remember, civil laws, there are suits that can be brought against you. I'm not going to review all these because I actually did a breakdown of your laws concerning nurses. So please look at this. It is in your Module C, and it talks about all the unintentional and the intentional torts that could occur. Remember, this is testable material. You will be tested heavily on this. So please make sure you'd be able to, you're given a scenario, you're going to be able to identify what law is being broken or what civil law could be brought against that person, and then what you would need to do. Now, we do have some potential protection. One is the Good Samaritan Act, but remember, this varies state to state, so you need to know wherever state you're going to practice in what their Good Samaritan Act is. Now remember, somebody can sue you for whatever they want to sue you, so they can always bring a lawsuit against you, okay? What this Good Samaritan Act does, it tries to protect you. But one thing you have to remember, you have to be within your scope of practice. For example, if you see an accident, you stop, you render aid, but it was not in your scope of practice. Let's say they had a collapsed lung, okay? And so for whatever reason, you're going to try and do something that's not in your scope of practice, okay? You can't, it doesn't cover you then. You have to be within your scope of practice. Now, governments, agencies, and people that work for the government, sometimes they're offered immunity, and so just realize that. And then also emergency situations. It kind of depends on the situation, and remember, I can't give you just a black and white. That's a lot of gray. It kind of depends on whatever is going on. So I say all that to remember, you need to look out for yourself. You put a lot of work in getting through this program and actually getting that RN. You want to keep it for as long as you can. So you need to get malpractice insurance. Now there's 2 trains of thoughts on here. Some people say, oh no, if someone knows you're going to have malpractice insurance, then they'll sue you. And then other people say, oh well yes, you definitely need to cover yourself. Well, here's the thing. How are they going to know you have malpractice insurance? Are you going to advertise that? No, you're not. But you need to have it. We also have some hospitals say, oh no, you're covered under us. That is true as long as you followed your hospital's policy and procedure and documented it to a T. If you did not, you can still be found liable. So that is why I always say get malpractice insurance. It is not that much, y'all. Okay. Now, when we talk about patient rights, some new things that have come up in the recent news. One is the right to die. That's the right to die with dignity. Now, I put this link on here. A lot of states, remember, they recognize this law, and so you need to be familiar with that, especially if you're going to practice outside of Alabama. Also, advanced directives. Now, remember, these are living wills and durable power of attorneys for health care. And then we also have your patient has a right for informed consent. Okay, they need to know what's being done. What are the benefits? What are the potential risks? What are the outcomes? Is there any other alternative therapy that can be done? And then again, AMA. This is your patient that's leaving against medical advice. That is their right. Now, some issues currently being seen in nursing is sexual harassment. Please remember that sexual harassment is someone else's interpretation of a situation. So just realize if it creates a hostile or offensive work environment, it can be construed as sexual harassment. So you need to know your workplace policy regarding this. Okay, and then also, how can you prevent sexual harassment? I always like to use the word think. Is what's coming out of your mouth thoughtful, helpful, and sensitive? Is it needed, and is it kind? Again, another one that we've seen very recently here is workplace violence. It is the fourth leading cause of occupational injury in the United States. Okay? It's 4 times more dangerous than any other occupation. It's only second to law enforcement. So in your box on 24-3, it talks about the types of workplace violence. And then these links I provided to you, it talks about how to prevent workforce violence and also bullying. Bullying is another thing that is really going on in healthcare right now that we need to try and stop. Okay? So please, again, read these links that I provided to you so you will know what all is going on.